This teaching video has three purposes: to illustrate for workers how to interview a child client in order to obtain the needed information, to demonstrate for supervisors how to conduct a clinical supervision meeting, and to introduce a case conferencing model that can be used by different work teams to enhance intervention with clients. The video will be divided into three parts: the intake interview with the child, the clinical supervision session, and the case conferencing meeting. A demonstration of each type of meeting will be given, and teaching points will then be highlighted. We will be following the journey of a counselor from her initial interview with the child, encountering difficulties in the case, and her case consultation and clinical supervision meeting with her supervisor, all in order to help her serve her client more effectively. This family has previous division involvement after the eldest child reported violence in the home and abusive behaviors by the father during visitation. The division could not substantiate the claims on the father and eventually closed the case. Before closing the case, though, the non-offending parent, the mother, was referred to the domestic violence liaison. The mother did not wish to engage in services for her or her children at the time of the referral. Just recently, the mother made a call to the Resource Center of Somerset to set up an intake for her two children, 8-year-old Jane and 12-year-old John. The counselor, Mary, is meeting with the family for the first time. Hi, everybody. Hi. Nice to see you. Welcome, welcome. So today I'm going to be asking you guys a lot of questions. And my very first question is going to be for Mom. Mom, what are your favorite qualities? Let's start with Jane. Your favorite qualities about Jane?
She gets good grades. She's helpful around the house.
Anything else that you'd like to add?
She's creative.
That is great. Great start. John, anything you'd like to add about things that you think are great about your sister? Okay. Jane, what are some things that you think would be good to add onto your list?
I like to dance.
Oh, do you? Do you like to dance on your own or with a class?
Usually on my own, but I would love to take summer classes.
Oh, that sounds like it would be so fun. I hope you get to do that. That sounds great. Mom, we're going to move on to John. What are the best qualities you see about John?
He helps out when he wants to. But you know, he started teasing Jane yesterday and...
You know what? I'm going to stop you right there. Right now, we're going to only focus on the positive things. What are some positive things you see about John?
I don't know.
Okay, well, you know what? That's okay. Take a minute and think about it. And if you think of anything later, let me know, okay? Jean, what about you? Do you see anything positive about your brother, John?
Well, he's tall enough to reach the top shelf of the refrigerator, which is helpful, and he plays with me sometimes.
So he sounds like someone you really love to be around, and it sounds like he can be very helpful for you. Okay, great. That's great, John. Those are great things about you. Anything you'd like to add to the list, John, of your best qualities?
I like to play baseball.
Oh, you do? Are you on a team? How long have you been playing?
A couple of years. I'm in the 7th grade, but I play with the 8th graders.
Oh, that is fantastic. You must be very talented to be playing with the older kids. I have a million questions for you about that. In fact, in a few minutes, I'm going to have time alone with you to ask you some questions. Could we talk a little bit about that then? Would that be all right? Okay, great. My next question is going to be for the entire family. What do you guys think is strong about your family?
Well, we all like to eat spaghetti.
That's not a strength.
You know what? If Jane sees it as a strength, I'm going to include it. It sounds like meal times or eating together is pretty important to you.
Yeah, we all gather on the table on Sundays to eat spaghetti, and no matter what happens, we stick together on Sunday nights.
Sounds like sticking together on Sunday nights, eating together is a very big deal. What do you think, John?
I like it too.
You like that too? Okay, great. Anything else I should add as a strength that this family has? Okay, we'll keep going. My next question is going to be for the kids. Do you guys know why you're here today?
No, Mom said we were going to play special, but instead we ended up here.
John? Okay, no idea. So let's check in with Mom about this. Mom, what made you want to bring the kids here today?
Well, you know that me and your father have been having some trouble and some difficulties, and I wanted you to be able to come here and be able to talk about your feelings and feel safe about talking about them.
Well said, Mom. That was perfect. This is a place where we specifically work with families who are going through tough times together. And when you come here, this room turns into your space. And we keep things very private here. Except if you're sharing that somebody's being hurt or you're being hurt, then we would have to make sure we not only include Mom, but possibly talk to a program called DCP&P, which would come into the home, check everything out, make sure everything's okay. Does that make sense to everybody? Anybody have any questions about that? Well, if there's no other questions, we can move on to the next part, which is where I'm going to meet with each of the kids on their own, and then Mom, I'll give you a little time at the end. Does it sound good? John, would it be okay if I started with you?
Okay.
Okay, great. So John, I was really interested in what you were sharing about your interest in baseball. Would you be able to share a little bit more about that?
Sure.
You must be pretty good. You were saying you were playing with the older kids.
I guess.
And what do you enjoy? What do you enjoy about it?
Well, I just like playing. I'd rather be playing than being here right now.
I appreciate your honesty about that, John. And it sounds like you didn't even know why you were coming here today.
Whatever. My parents never tell me anything.
That must be very frustrating for you.
I'm used to it.
Well, this is a place where we encourage open communication and honesty. And I want you to be able to feel free to say whatever you need to here. And in fact, I get the feeling that is there more you'd like to share about that?
I just wish everyone would leave me alone. They're the ones with the problem.
By them, you mean your parents?
Yeah, they're the ones who have to come to therapy or whatever.
It sounds like things are pretty difficult right now.
I don't want to talk about it.
That is totally fine. And I want you to know that during therapy, you can say at any point, I don't want to talk about it or pass. Today's a little different because I have to ask you a ton of questions because we're first meeting each other. But seriously, at any point, if you feel uncomfortable, feel free to say pass. Is there any questions you have for me before we get started?
No.
Okay. So John, my first question for you is, how are you today?
I'm okay.
Great. My next question is, where do you go to school?
Central Middle School.
And what do you think about Central?
It's fine. I like playing baseball there. I have some friends there.
Oh, that's my next question. What do you like to do for fun? You mentioned baseball. What else?
Listening to music, watching TV, drawing.
Oh, drawing. Can you tell me more about that?
Well, my friends asked me to make them, and one day, one of my friends showed the teacher, and she said I should put one of them in the school paper.
Wow, that's really exciting. You don't happen to have any with you, do you?
I do.
Oh, you do? Oh, it's a little one. I love that. Wow. Oh, you're really good. You have so many skills, I can tell. You don't happen to have more of these at home, do you?
I do. I have a couple.
Would you be able to bring them in sometime and show me? I'd love to see more.
Sure.
Oh, that would be great. Thank you. Thanks for sharing that. My next question is, who is in your family?
My mom, my dad, my sister, and my dog Rex.
Okay. And who lives in that house with you?
My mom, my sister, and my dog.
Okay. So I noticed you didn't include your dad.
Yeah, he lives in a separate house.
Yeah, you mentioned earlier that they were having some problems. You don't have to answer the next question if you're not comfortable, but how would you say your family gets along?
I don't know, they just don't get along. Fight a lot. I have to visit Dad now and I just don't like going. He can get really scary sometimes. He screams at me, grabs me by the arm really hard, pushes me against the wall, stuff like that.
That sounds very scary. Has he ever left a bruise or a mark on you?
He did in the past on my arm, but it isn't there now.
And how often does this seem to happen?
Most of the times I go to visit. DCP&P has been called a million times in the past, but nothing ever seems to happen, and I feel like nothing ever will.
You may remember in the beginning I mentioned that if anything was unsafe with the family, I would need to reach out to DCP&P.
Yeah, I remember. I figured you would have to call them again if I told you this.
Right. So at the end, we'll bring Mom in and we can talk about it together, and you guys can even be present when I contact them if you like. Okay. Is there anything else you want to tell me about your experience with Dad or anybody else that's making you feel scared?
That's it.
Okay. So let's make a safety plan so you know what to do in case anything like this ever happens again.
Okay.
Okay, so let me just write this down. You said getting yelled at, grabbed, pushed against the wall.
I just wish I didn't have to go.
So I'm going to write down going to Dad's in general on the top of the list of the safety plan. Got it. So what would you say are three safe things you can do to take care of yourself when something happens that makes you feel unsafe?
Well, just stay out of his way or stay in my room. I could try to go to my friend's house, but he never lets me go.
Okay, those are really great ideas. And are there neighbors close by that you trust?
Yeah, my friend and his parents live a few houses down, and I could go there if I really needed to.
Oh, that's great. And do you have access to a phone at Dad's house?
I have a phone, and I try my best to hide it from my dad before he tries to take it. I guess I could call my aunt, my mom, 911 if I really needed help.
Those are great ideas. And what would you say are the safest places to be inside of Dad's house?
Probably my room or the bathroom. They both have locks. The basement, which has a second door that leads out to the backyard.
Okay, great. Those sound like really good options. And you seem to really know this plan. Have you talked to your family before about this?
Yeah, we kind of went over that. We all agreed to meet at my friend's house if we need to get away quickly.
Wow, that's really great. I'm glad to hear that your family can talk together about difficult things like this.
Well, we don't very much. I just asked everyone if they thought it was a good idea, and they all agreed.
Well, that's really smart of you to think of doing that. Is there anything else you'd like to add to the plan? Okay. Well, before we get ready to end for the day, I just want to close things up a little. Let's talk a little bit about regular day life. What are some things you have to look forward to this week?
Well, I really can't wait to play baseball when I get home.
Oh, great.
The session with John ended on a positive note. The mother was brought into the session, and the discussion to report to DCP&P was discussed with both Mom and John. Mary gave both Mom and John the option of being in the room while Mary reported to DCP&P, but they chose to have her report for themselves. We will pick up with this session after we highlight some of the skills and techniques Mary used in this child interview. The key to interviewing a child is developing rapport or a trusting relationship so that they feel safe and respected. They are more likely to respond to difficult questions if the time is taken in relationship building. Mary did this by asking about the child's strengths. Kids will connect to you more quickly if they see you are focused on their positive qualities and them as a whole person, not just the problem that they brought to you. She used a strength-based approach another time by keeping the mother on task by focusing on the positives, modeling appropriate boundaries and setting limits for the whole family. By doing this, she forged a bond with the children. Kids who seem resistant are used to adults focusing on their bad behaviors. She also created a safe space for the child by setting clear and consistent rules for the session, empowering the child by following his lead. Even though the conversation seems tangential, especially when there are time constraints, talking about their interests is a great way to bond with kids. If you can get a child to share something they made or know how to do or enjoy, it is a great way to build rapport. This way they feel more in control of the session and don't see it as problem-focused and become less resistant. It also gives them a chance to be successful at answering questions.
so that they feel more confident in answering when more difficult questions are asked. Studies show that if you ask children questions they know the answer to, they will be more likely to answer more difficult questions that follow. Letting the children see the worker point out what they are saying is important and that they are believed, especially if it has been disregarded by someone else. This again makes them feel like they were heard by the counselor and their concerns will be taken seriously and believed. This sets the stage for when the topic turns to abuse. At that point, validation, as "I believe what you are saying," may be enough. Being very clear about what kids can expect to happen. Tell them what is going on and what to expect, being as transparent as possible. Mary did this when inviting the family to be present when the report to DCP&P was made. Other examples include sharing the structure of the session before it starts and setting the guidelines about confidentiality and its limits. This builds trust by showing the child that you will be honest and open with him. Always encouraging questions. This not only builds trust by showing the child that his concerns are important, but this also ensures that the child understands what is happening, will have a chance to have his fears allayed, and that the worker and the child are communicating effectively. Not taking offense when a child doesn't want to meet with you. This is a great opportunity to show the child that you can really hear anything that they have to say, even that they don't want to see you. It is a great moment to talk about something that really bothers them. Helping to develop a solid safety plan. Even if they have said everything is fine, nothing is wrong, it is important to double check that they know what to do in case of an emergency. You may want to start off gently with what are the top 3 things that scare you and top 3 things you can do to be safe. Through this process, you may be able to get more details of past incidents. Using nonverbal communication to bond. This may include where the counselor positions herself in relation to the client and the rest of the family, which may depend on who needs more support or to be aligned with. It also includes dressing in a casual manner, getting down to the child's level in terms of height, tone of voice, etc. Using the environment such as toys and drawings may be helpful for the child to demonstrate what has happened rather than saying it. Helping kids to close back up or prepare to integrate back into regular life. Because the counselor was the one to open up the stressful conversation, it is her responsibility to ensure she leaves them grounded and ready to face the world. A kid that is not closed back up could well leave the session and immediately have big behavior problems as a result. Helping the child feel emotionally safe is a big part of building the relationship that will allow them to disclose. Clinical supervision has 3 purposes: to provide administrative, educational, and supportive leadership. Administrative supervision is the type most often practiced in the division, as it focuses on providing direction around policies and procedures, documentation, liability, and tax completion. Educational and supportive supervision are more frequently practiced in clinical settings and have been shown to build the capacity of workers to assess and plan more comprehensively and achieve the ultimate goal of providing clients with more effective services. Educational supervision focuses on developing the worker's ability to think about cases from more than one perspective, develop and evaluate strategies to achieve case goals, and also brings in training as needed to understand the problem. Supportive supervision focuses on helping workers feel confident in doing their jobs and on stress reduction. The objectives of clinical supervision are to improve workers' abilities to do their job effectively, grow professionally by building skills that they can use independently, and make them feel comfortable doing their jobs. Mary met with John for several sessions and continued building the relationship with the goal to get him to express his feelings and to heal from the trauma he was experiencing. Each session was similar in that John would disclose more abuse on visits with his father, Mary would report to DCP&P, and the allegations would be unsubstantiated. Mary was unsure where to move forward with John's treatment and decided to bring the case to her clinical supervision.
So, I'm here to talk about John's family today.
So tell me a little bit what's been going on with his case since the last time we talked about this.
Well, he's been doing really well with counseling. He's been connecting well with me. So I have to call DCP&P basically weekly. And when he speaks to me about it, he expresses a strong fear. But when he speaks to a DCP&P worker, he doesn't express the same intensity of fear to them.
So what's he been saying about the contact with his worker?
He says he's been through this so many times, and he just sort of feels like nothing's happening.
So he's feeling discouraged?
Yeah.
Well, I think that's an appropriate reaction to this situation. Do you know if it would affect your work with him, or how will it affect your work with him?
So he's known from the beginning that I would have to contact DCP&P if he made any allegations, and so he understands that, and I think he feels comfortable telling me. He does tell DCP&P the same things that he tells me, but again, it's like just not as urgent, the fear, or he just isn't expressing the same intensity of fear to them that he is to me.
Are there any other times with other clients that you felt in a similar way?
Yeah, I have. I work with the children, so it's really hard to see the kids kind of trapped by their parents' decisions. He doesn't even get to choose if he comes here for counseling. So that's always an issue I'm dealing with the kids.
So what's different about this case?
I guess I feel like I'm failing him, and that just feels terrible to me.
Well, I definitely don't think you're failing him. I think just sometimes the system has to work in a certain way, and their hands are tied too.
It feels like, I guess the bottom line is it feels like I'm the only one that believes him.
And that's a lot of pressure and responsibility on your part.
Yeah, and I guess I'm worried that he may stop trusting me.
Well, I think it's evident that he continues to trust you and open up to you. I think just continue to support him in sessions and validate his feelings, validate the experiences that he's having with his father. And if any new incidents do come up that you have to report, continue to report those too, because that's, in that way, it's continuing to validate him.
Yeah, I've spoken with the caseworker. It just seems like they don't get the same feeling of intense fear that I'm getting. I don't know if he's minimizing it or what's happening. And I also wonder if they have a negative impression of mom, that maybe she's feeding him information.
Have you thought about maybe discussing this with the caseworker?
I haven't. I didn't want to break confidentiality.
Well, we do have a release signed for them, so maybe it's a good idea to talk to the caseworker, express, the different interpretations on this case, and kind of going over the difference between coaching their child versus just being a parent that's trying to educate them and advocate for themselves.
That's a really good idea. I guess I'll just have to think about what is appropriate to share and what isn't.
Well, your role as a counselor is the safe person that he can go and talk to. So just continue to revisit the safety plan in sessions and maybe speak to his caseworker again.
I will, although I'm not sure if that'll change anything.
Well, it might if a new incident arises. Are there anything else that you've thought of?
Well, I could get a release form to speak to the DVL, and maybe she could help me even understand a little bit better about how the system works. It does get a little confusing.
And that's a really good idea. And remember, always you can call DCP&P and speak to a supervisor there, or you can speak to the caseworker supervisor.
Yeah, I'd really like to address the therapy goals and move on from reporting.
And this would be a good case to present at our next case conference.
The rest of the hour session consisted of reviewing other cases Mary needed feedback on prior to her next week's meeting with her supervisor. Supervision should be consistent in terms of being regularly scheduled and follow a structure. At the Resource Center, both the supervisor and the counselor bring an agenda and mutually decide on which items to address first. Because we are about empowerment, the counselor usually takes the lead so that her most pressing issues are met first. Administrative issues are secondary to teaching and support. It is also important to create a safe space for the worker and develop a trusting supervisor-supervisee relationship. Supervision is about coaching to enhance skills, and unless the worker feels free to discuss her limitations, she will not grow professionally. The supervisor modeled many different skills in clinical supervision, including listen. Ask questions and explore the problem presented thoroughly. Do not give answers or solutions prematurely. This is about getting the worker to think for herself, generate her own solutions, and evaluate the quality of her own solutions. Questions should be open-ended to allow the worker to present all of the issues of concern and to start to think about the things she may have overlooked. Clarify what the worker needs from you. Is it direction, answers, help thinking things through, management of feelings, or support? Paraphrase what the worker is saying. This will ensure the supervisor understands the worker's needs and also focuses the discussion. Reflect the feelings and experiences the worker expresses. This will make her feel supported and understood. Challenge gently the way the worker is thinking about the case. Is it her own feelings towards the child or countertransference, or her own issues that are making her have a strong reaction and need help? Or is it truly as difficult as she perceives? Generate alternatives for handling the case. First, see what the worker has thought of or tried and whether or not it has worked. Then generate other ideas and weigh the costs and benefits of the strategy. Give feedback tentatively. This may include suggesting reasons the interventions worked or did not, new paths to take, or why the worker feels as she does. Always check back in with the supervisee on their perception of this. Provide direct support. This may be in the form of information, answers, direction, resources, training, or modeling. It may also be praising the worker's handling of the case or her strengths. Be aware of the parallel process. What happens between the client and the worker is reflected in the relationship between the worker and her supervisor. The client was discouraged and frustrated and needing help, so was the worker. The worker was trying to provide support to the client and find solutions, and so was the supervisor. Develop a plan. Each session should end with a plan of the next steps for the worker to take. The next week, Mary presented John's case at the clinical case conference meeting. Case conferencing is a form of group supervision that includes the counselor presenting, the supervisor as a group facilitator, and other counselors on the team. The purpose of case conferencing is to provide the counselor with feedback and suggestions from colleagues as to the handling of the case. The case presented should always be one in which the counselor is stuck or is struggling. Case conferencing is not to show off the worker's ideally handled cases. Another purpose of case conferencing is that it serves as training for other counselors who may be facing similar difficulties. In preparing for the case conference, the counselor will prepare to concisely discuss the case in terms of the psychosocial assessment, interventions to date, current difficulties with the case, and feedback needed from the team. Sometimes the supervisor will help in the preparation as well as selecting the case to be presented.
You were here.
So, hi everybody. I'm going to present today on John and his family. So, starting with his grandparents, John and Elizabeth, there was a verbal, physical abuse going on between them. Mom was dealing with depression, suicidal ideation, as well as some attempts of suicide. Moving over to John's father's side of the family, we have Alex, the grandfather, who died 7 years ago of cancer. He was verbally and physically abusive towards his wife, Sarah. Also very verbally abusive towards the 3 siblings and towards John's father. Also signs of neglect, lack of care for David. Sue also dealing with depression, as well as Michelle. And then the twins, Tony and Jamie, dealing with alcoholism and drug abuse. Sue and John they display a lot of conflict, and John and Jane have a lot of conflict. John and Jane keep the paradigm where one child tends to be the problem child, one child tends to be the people pleaser and has to be perfect. So Jane's the people pleaser, John is the one who's always getting into trouble, things like that. A little bit about the family of this family of origin. So we have John and Jane living with Sue for the majority of the time. There is visitation with David. That's every other weekend, and then 2 days during the week, not overnight. They've been separated for 6 months. There's been an FRO in place for about 6 months, and before they were separated, they were married for about 15 years.
Well, I see Mom for individual, so you know, what she's reporting is it seems like he has a lot of anger toward her for not protecting him from what his father does. And I think she tends to treat him like a grown-up more too in terms of her communication. He seems, that she tells him things kind of at maybe a higher level than he should be.
So yes, definitely. John is quite angry with Sue for not protecting him. Feels like he is the target of David and has nobody standing in between. And definitely John does know a lot of information, way more than he probably should. So there are some concerns about parental boundaries, parentification, things like that.
So just in terms of the whole psychosocial assessment, how's John doing in school, doing with friends? Are there any supports in that area?
Well, John does struggle with grades, doing well, which is also a huge source of conflict between Sue and John. But he does have friends. He's very into baseball, which is a huge strength for him. And he has friends that he likes to play baseball with. He's not really involved in any other groups, although DCP&P is currently involved in the family.
So as a protective factor, who can support John and Jane?
So John does reach out to his Uncle Rob. They do have a bit of a bond that's really positive and empowering to John. So in his safety plan, we actually did create ways that John can see him a little bit more, spend a little more time with him. So that's where we're at with as far as support so far.
Okay, so Mary, can you tell us a little bit more about how long you've been working with John, some treatment goals, and what do you want, what kind of feedback do you want from us today? Maybe where you're stuck with working with him?
Well, I've been working with John now for about 6 months. Goals I have for him is to address symptoms of depression, feeling identification, conflict resolution with Jane and Mom. But we've been really stuck on safety planning because of all the reports he makes when he goes to visit Dad, getting hit in the arm and leg, getting shoved. At one point they were driving, well, this actually has happened several times, driving around in the car, Father will see an accident, will take the kids over to look at the accident, will videotape the accident, and then replay it for them when they get home. So we constantly are reaching out to DCP&P. Basically every week we've been contacting them. And I'm getting very frustrated, as well as John. He's feeling very frustrated because he hasn't seen any results. Nothing has happened so far. So we are just feeling very stuck right now about this whole scenario and what to do next.
So why do you think nothing happens when you're reporting to DCP&P? You said nothing changes. What's happening?
Well, the feedback I keep getting from DCP&P is that he's not expressing the fear as strongly as he is to me. He also has told me this, that they ask him to give like a fear scale where 1 is not scared at all, 5 is very scared, and then what he tells me he does in those situations is if one abusive act occurs, he subtracts that from the 5 and brings it down to a 4. It's not uncommon for kids to have a little trouble with relational scales like this. So I think that that's something that's kind of getting in the way as well.
Well, maybe he can make his own scale, one that makes sense to him. So instead of using numbers, you can use pictures or feeling words, and also maybe even take pictures of him making different facial expressions and use that. Maybe that will make more sense to him.
That's a really great idea. I think he'll really respond to that, especially he's very artistic, so I think images and things like that would be perfect for him.
Or maybe he could keep a journal to write down the incident after he returns from visits with his father, so it's still fresh in his mind and he could be more descriptive.
That is a really good idea. I guess I'm a little concerned. He's so articulate, so smart, uses really big words. I guess I'd be worried that DCP&P might think the information he wrote down would be fed by Mom. So that's my only concern with that.
I agree with Mary. I think that John's taking a big chance with DCP&P, and if he's so articulate, he should be able to communicate exactly how unsafe he's feeling with Dad.
I have definitely seen that in some other cases where very articulate children have tried to write journals, but unfortunately being parentified in the family unit has come off negatively to DCP&P. So just something to worry about or think about if he is going to continue journaling.
Yeah, you're right. I'm not sure what the response would be. But I do think it would be a really great way for him to express himself and very empowering. And it might be a really great way for him to advocate for himself, so I think it would be worth a try.
Mary, do you know if Sue has tried to file for supervised visitation through the courts?
I know there is a restraining order that allows for unsupervised visitation. I'm not sure where the divorce is right now, but I do worry that if Mom tries to protect him, she'll be seen as alienating him from Father.
Maybe Sue would like to come to one of the legal clinics, or we can offer the custody workshop is coming up on custody and visitation, and we can do something with that with her.
Well, I'll definitely have her contact you.
Okay, so maybe the plan moving forward, Mary, you can work individually with John using a fear scale, therapeutically with journaling, and Mary, maybe you can do some legal options with Mom.
That sounds like a really good plan, everybody. Thanks for your help.
The benefits of clinical case conferencing were clearly illustrated in this case. They include providing a variety of points of view and experiences for learning and problem solving, obtaining support for common problems faced by workers, communicating skills and concepts to a larger group that they may use in the future, giving direction to the worker as to how to proceed on the case. Certain components should be included in all clinical case conferences, as was seen in Mary's presentation. They include presenting problem, additional problems, psychosocial assessment, family functioning including history, dynamics, strengths, and challenges, involvement of other community resources, intervention to date, areas where feedback is needed. The case conference should have a defined purpose. In this case, it was to guide and direct the worker. Other purposes could include to build certain skills and model their use, educate on concepts as applied to a case illustration, discuss constraints of an agency as applied to a particular case. The supervisor's role in a case conference is as a facilitator. Skills may include case selection based on the purpose of the meeting, helping worker to organize clinical case material in a concise way and preparing their presentation, thinking ahead for potential solutions to the problem in case this must be modeled. If appropriate and needed, share educational material that may be applied to the case. Consider different learning styles when selecting cases and topics for case conferencing. Listen. Respond. Delay the supervisory response until after the other team members have participated. Sometimes the supervisor input ends the discussion because it is taken as the final word. Respond as needed to spark others' thinking or participation. Respond to keep responses relevant and on track. Respond to correct misinformation. Respond to address safety, legal, ethical, and liability concerns. Encourage all to speak and share material and experience. Conclude with a plan to go forward. Mary moved forward with the case plan. She was successful in helping John communicate his fears to DCP&P. His visitations were briefly suspended, and then they were supervised for a while. This relaxed the child, and the treatment was able to progress. John was feeling safer, more able to express his feelings, was developing a support network, and feeling stronger. The parents' divorce case proceeded, and as a result, John was ordered to engage in counseling with his father and was no longer able to receive counseling from Mary at the Resource Center. But she takes comfort in knowing that she did everything she could to help him.